I'm home with Wright, and I had a L5S1 spinal fusion done by Dr. McFarland at Orthopedic Spine Center in March 31st of 2022. And what initially led me to come here was I had an injury back in 2002, if my memory serves me correct. And I just been dealing with the pain. It wasn't anything major at the time. Like I would work out or play basketball, and then my back would kind of like get really, really tight, and I'd have to sit down and wait for it to subside. And then in 2017, a coworker of mine had a back infusion, and I was talking to him about the pain in my back and things that I would do to try and alleviate that pain. And he told me that he said, well, you should go to OSC and see Dr. McFarland. And I said, okay. So I called, made an appointment, and came in and met with Dr. McFarland. And the first thing he said, well, let's get some MRIs and X-rays. And so we did that. I had X-rays already, but they didn't show anything. So he did an MRI, and then he said, this is the problem. I had to come back, speak with him, and he said, this is the problem. The problem is you have two discs. One is bulging, one is herniated. And I said, okay, so what's the fix? Surgery, he said, you're not a candidate for surgery. But what I can do is I can give you these injections that will help with the pain and give you some form of normalcy. I said, okay, fine, let's do it. So we did the steroid injections, which gave me some relief, gave me a lot of relief. Actually, I was absolutely no pain. And that went on for um, 5 years. And then this January, I called Dr. McFarland to set up for an injection and just to speak with him. And I spoke with him and I said, these injections are not working anymore. So what's next? And he said, well, probably surgery, which I was totally against. So I said, well, what about stem cell? I'll just pay for it out of my pocket. And he said, well, his words, he said, well, I could do the stem cell, but I don't want to take your money because it's not going to work. What doctor says that? So I said, okay. So I said, what kind of surgery would it be? Knowing that it's a back surgery, most people have the horror stories of your back surgery being the rods and the screws and things like that. And he pulled it up and said, nope, that's not what we're going to do. We're going to do this. And I said, okay. And he showed me this little device. And I was like, okay, well, let me go home and talk to my wife, see how she feels. So I went home, I talked to her, and she said, call him back, do the surgery. Even being skeptical, I called him back, I scheduled it, they got me in, and they gave me a date. And it was March 31st. I was like, okay, so this is happening. Then went March 31st, came, went and had my surgery, woke up 2 hours later, and I was on my way home. It was great because Erin was there, and Erin was my PA. So she came in the room because I was really nervous, and she was like, "You don't even know who I am," and she had a mask on, and I said no, and she pulled it down, and I was like, "Oh my God, it's Erin!" She was like, "I'm going to be with you." I was like, "Oh, thank you so much," because I was scared. I'm a fireman. I don't. That's nothing, but I didn't have control of that situation. And the procedure was pretty short. From the time I went in until the time I was in recovery, it was like 2.5 hours. It was short. OSC scheduled my physical therapist to come in 3 times a week, and OSC also scheduled my nurse. I had a nurse also to come in, and she came in twice a week. And I had no clue that I was even gonna have that portion of it. I thought I was going to have to do all that on my own. But Miss Shelley downstairs said, nope. She was like, I was going to take care of your physical therapy and your nurse. And I said, okay. So I don't have to do anything. Just be home and recover. So from the time I had my surgery until he released me back to work. So I had my surgery March 31st. Dr. McFarland released me back to work, light duty, on June 7th. So from that short time period, I went back to work, but only on light duty. And then last Monday on the 24th, he released me to full duty. So I wasn't able to run. I wasn't able to. I could work out, but I couldn't run and I couldn't lift like I want to lift. Because as you get older, you have to do some other things to stay to keep you moving. I couldn't really stretch like I want to, like I need to, especially being a fireman. I went to a chiropractor. Those are the things that I did to try and help, but none of those things were helping. That led me back here to OSC for Dr. McFarland to do everything. But I really couldn't go play basketball with my son. I couldn't weight lift like I want to. I couldn't really go like it got to a point to where we have dogs. I couldn't even walk my dogs. Like, and my wife was like, well, you can't even walk the dogs. It's all on her. Because of the pain, like every step, there was radiating pain down my legs and just the muscles in my back tightening up. It didn't allow me to do anything. But now, and even before that, I would be at work, and by me being a firefighter and being a fire inspector, I have to walk. So sometimes I couldn't walk all day. I'd have to go sit down. Now I don't have those issues anymore. I don't have the issues of not being able to do my job fully, or I can play basketball. I ran on the treadmill the other day for the first time. And now I'm lifting weights. I'm doing a lot of lower exercises that I couldn't do before my surgery because it hurt too bad. And I try to stay away from it because I didn't want to damage anything more than what it was already done. And then Dr. McFarland gave me the green light. He was like, just be mindful. And he did say I would have some limitations with the fusion, but I haven't seen any of those limitations yet. I can still twist and turn and bend down and squat, and so I'm doing all the things I couldn't do before my surgery. Now he has definitely changed my life as far as dealing with pain. I don't have any at all. I'm back to basketball. I'm back to lifting weights and deadlifting and things like that. But I've recommended Dr. McFarland and OSC on several different occasions since my surgery. I know 5 people I've already recommended him to, and I've physically written down his name and number and OSC, and even given direction. I've drawn a map to where they are so that people can come and get the same procedure that I had if needed. I never thought I was going to have back surgery. I was like, I'll never have back surgery. But Dr. McFarland changed my mind. Just his mannerisms and talking to him. We talk football, we talk basketball, outside of talking about my spinal fusion. So I think he's probably one of the best doctors I've ever had as far as bedside manner. So I recommended somebody today. I recommended actually 2 coworkers too. One of my coworkers, Tim, is having back problems, and I said, man, you need to go see Dr. McFarland at Orthopedic Spine Center, and wrote his number down and his name and gave it to him. He's like, I'm gonna have to call him. I said, yeah, you need to call him. I was like, you'll be like me.